She does PRP for joint injections, she has stem cells, and I learned a lot, and even Botox for migraines. So I learned a lot from her. It's interesting how it crosses over too.
Yes.
So I did that, and my mom was an excellent teacher too. She was great to watch with her patients. So I learned a lot about patient care and how to sort of build trust, because so much of this business is trust. As time went on, I was working in the OR as I was a clinical director at Greenwich Hospital. So I was doing that, and then going to my mom's office and working out of one of her rooms, just doing like Botox. And then over time, it's grown. And then in 2019, I quit the hospital completely and just went into this full time. And then it's just grown exponentially since then. COVID was really good for me because I did a lot of Instagram, and that really helped my business. And I've always, I'm a big proponent of, obviously there's places where we need Botox or we need fillers, but as much as you can use your own body, and aesthetics in general is really focused right now on biostimulating. It's like, how do we stimulate our own collagen production?
Yes.
So that's what's neat about PRP.
Yeah.
And so that's how I got to where I am today. As far as building your business, because it's your own business within a group. That's what happens. You develop relationships with your clients and they come back to you. The people you're meeting right now, your microneedling and chemical peel are going to be a great source for you, because you're going to build that trust already, and then you can just sort of grow from there. PRP is going to be great because you'll have some options with that. PRP, and I'll go over this with microneedling, is the best. It's amazing. So this is going to be a good thing for you to incorporate as well.
Thank you.
Botox, I think it's always critical that you have Botox and filler skills, because those are sort of the base things that everybody comes in for, and then you can kind of go into this other stuff too. So I would suggest definitely kind of doing some more learning on that, because that way if you can do cheeks and Botox or lips and Botox, then you've got your core treatments, all you need. And it's, and it's a great revenue, and you build up your practice really fast. So I'll kind of go over what you use where and why it's beneficial and why it doesn't work in some other areas too. Kind of whip through this because it's not super, a lot of this you already covered. This is what it is.
Yeah.
The way that I describe it too is, and I learned this from my mom because she's very visual in the way she describes stuff, and she always talks about PRP. She's like, for her patients, she's talking about a joint. She's like, it's basically because it causes neovascularization, meaning new blood vessels. She's like, it's like a barren field and you're throwing in a whole bunch of irrigation. And I was like, that's such a great way to put it. So essentially that's what we're doing on the face as well. And you want to think about what is PRP's goal, and PRP is to help the cells. So you want to think, what cells are we trying to impact? So that's going to affect the depth that you inject, because on the face you're not going to want to go down to bone. It's not going to do anything. Maybe you'll make their cheek feel better, but it's not going to be visibly any different.
Yes.
So, and it's the PRP causes your body to have that inflammatory response, and the inflammatory response is how we heal, how our skin gets healthier, how it gets stronger, it reactivates cells. So I always tell patients a big thing with it is to stop anti-inflammatories a week before and stop them for a week after, and do not ice, because it's counterintuitive. They don't think about that. So I always say, you can take Tylenol, you can do heat, but don't ice it, because it's gonna reduce what you're doing. The other one that you were sort of asking about is the PRF or PRFM.
Yes.
So that's platelet-rich fibrin matrix. All that is, and you can obtain it in different ways. And there's companies you can actually order, and it spins it and has certain ingredients in the tube that it does it. Or you can manually just add an ingredient to the PRP that will make it a fibrin matrix. What the fibrin matrix means is it's essentially causing it to become gel-like. It's tightening everything up. So when you use it, you want to use it in areas where you want to be very precise. You don't want it to drift everywhere. That's key. The other thing is, it's an area where you want, what it will do is cause a longer inflammatory response. So PRP will kind of be like boom and then stop. Yeah. PRFM is slow, long, and then goes away. So PRFM, my favorite, is for under eyes. That's what I do in under eyes. Because you want that to stay where you place it.
Yes.
I always warn people, you're gonna look puffy because it's such a small area and there's not a lot of way to hide it. So, I kind of make them mindful of that, but it's a great treatment for that. I don't do the centrifuge. I've been looking into it, and I may do it at some point, but for right now, I just manually do it, where I spin my PRP, and I put the quantities in here so you'll have it as reference. But I mix it with calcium gluconate. And calcium gluconate is basically, if I'm doing under eyes, I'd say I do like 1 cc per eye. And in that syringe, you'll have 0.9 of PRP and 0.1 of calcium gluconate. And the tricky part with that is that you don't want to mix it until right before you use it, because the second you mix it, it's going to start getting more and more gel-like. And I've had it happen where it became so gel-like you can't even inject it. So I always do it literally right before I inject them.
Okay.
And then these, I'm going to get more into that too. But these are basically just the different brands, and then that are good. You have the M-Site.
Yes.
The Suniva is what I use. The Suniva does give you a little bit more of a platelet yield, but you know, use what works for you, and you know, there's always companies out there. You just want to make sure that they actually are measuring what their counts are, and that.
And do you do one spin or do you do two spins?
I do one spin. There's different data, and it depends on the centrifuge and the type of tube. For this one, we don't, because it ends up breaking up the platelets too much. So you're supposed to just do one spin. I know M-Site you do two, and that's their protocol. And
yeah, no, they have the 20cc one. They do one spin now.
Oh, good.
Yeah.
Okay, so that works. So yeah, so I would do that for sure. There's mixed thoughts on it, because it does isolate to some degree, but then you also risk damaging a lot of the platelets. So it's a balance, and I usually defer to the company I'm using because they're the ones doing the studies for the best results. I know anatomy I kind of went through in the pre-course, so I won't go this, but I just want to make sure you have basic anatomy. I would definitely suggest reviewing this.
Yes.
One of the most, things to really think about, and I'm going to go into more slides, but these infraorbital foramen are really important, especially when you're doing cheeks or cheek filler. So you always be mindful that you've got that, and you've got all the vessels coming out of there. Up here, same thing, that supraorbital foramen as well, a lot of vessels coming up this way. So that's like bruising risks. With PRP, they say there's a risk of occlusions. I think it's very low. I think, filler is the one we worry about occlusions the most. But most of your injections are going to be upper face, so just be mindful of those two spots. When we're doing around the eyes, you want to be really conscious of all the vessels through here, so I'll kind of show you how I minimize that too. Bruise here, well, patients are devastated because it looks like they've had a black eye. Like it's a rough one to have. So it's like if you're mindful of that, it makes a big difference. You still have some pretty superficial vessels, so you're always at a risk. Like it depends on the where the vessels lie. So the big thing is you've got this facial artery that runs up to become the angular artery and then comes up through our nose basically. And when it's right here, it's actually very superficial. So if you're putting PRP in the piriform aperture or in the nasolabial folds, there is a risk of the vessel being there. The risk of occlusion, I think that the number is so low because it's not coagulating. It's got an anticoagulant in it. So I don't treat it the way I do a filler. A filler, I'm always aspirating, and I don't with PRP because and if you did have an issue, I would suggest just massaging it because it's going to be something. It's just going to be too much in one. And then vessels, that was what we sort of talked about. So if you can kind of spend some time, I would suggest learning these. These are the key ones for all the injections we do. And I would definitely suggest, if you can do it, is do a cadaver course. The cadaver courses, you learn so much, and especially because it lets you see where those vessels lie and you're able to like visually touch and understand it. It helps so much. You have to do it right because that's your credibility and your trust. And if you don't do it right, no one trusts you. So that's a big piece. And I think that's a big mistake a lot of people make, is they sort of see money and they're like, instead of like, well, what do I want for the best results? What's going to be the safest? Okay, so as far as the facial layers go, this is obviously not quite as critical for this. We're really going to be staying more in the skin because you think about, we're trying to improve the skin texture. So you have the epidermis and you have the dermis, and then you have the sub-Q underneath. Unless it's on the eye, then there's no sub-Q. But basically, we're going to be staying in that really, really superficial level, which is why I love microneedling with PRP, because you can stay superficial and really get a good boost with it. But the other layers are important when you get into fillers and things like that, because you want to know placement. If you do threads, they're much more. Threads definitely also, I was going to say, I would hold on threads. Wait until you feel really proficient with Botox, because people take them lightly and they're very risky. It's a minor surgery essentially. Yes. And give yourself time, because people don't ask for it as much either. If you can do Botox and filler, you're good. And then you could always, as you feel comfortable, then do threads. The other thing I definitely suggest, as soon as we're done, try and do it as quick as you can. Do it as much as you can, because you're gonna forget if you stop and wait like a couple weeks. But if you have a friend who'll let you do it, or you just start incorporating it in, like we do for our microneedling, we offer microneedling with hyaluronic acid and we offer microneedling with PRP. I push the PRP for anyone that's got any hyperpigmentation. It is it's the gold standard for it. It's the best. We get the most amazing results with it. highly, highly recommend it. And you can do PRP as an add-on. You can have a price to what you would charge to add that on. You're going to want to calculate what your expenses are, what your disposables are. I'm not sure how expensive yours are, so you want to, because I think they're not cheap. And you don't need the 60cc. The 30cc is plenty. But just so you know, like Suniva, if they're $85. If you buy a certain number of tubes, they give you the centrifuge.
Oh.
So that's why, so your cost would go down if you switch to like a company that's one tube. So if I look at it like, okay, I'm paying $85, what I usually double it. So say I do my add-on for 200 or something, then you make your, profit off of that. I would definitely suggest drawing blood as much as you can, sort of getting comfortable with that and sort of, just practice. So processing the PRP. So with what we're doing, we're using it, they call it 12cc, but it's really 7 or 8 cc's we're getting out of that tube. We put in centrifuge for 6 minutes. I mean, this is all based on Suniva, so obviously yours would be different. Once it's done, I'm gonna talk you through it, how we do it, but we're gonna mix it so we incorporate that buffy coat into the plasma, so we use that as well. You wanna use it all within 4 hours, because it's not gonna stay viable after that. Kind of put some of the supplies you'll need to be mindful of getting, like most of those you get in McKesson or, Henry Schein. Alopecia, so this is just kind of explaining how this works, and essentially it's only effective if someone's thinning. If someone has no hair, it's not going to bring it back. He's a great candidate because he's got good hair. He's just thinning a little bit, so it'll kind of boost that up. I try to encourage them to also use minoxidil as well, which we have topically, because you get that added boost and the results are better when you combine it. So they can start the minoxidil before they start PRP, and then when they do PRP with their hair, I have them not wash it for 24 hours. So they just take a break for 24 hours, and then after that they can resume it. And you can do the oral as well. That's another option for people. I find the topical is pretty effective though. People do well with it. And then these are just supplies you'll need for this, and we'll go through this. One of the things to be mindful of, so because we're gonna do scalp right now, is the scalp is so thin. There's just not a lot there. And the injections are really superficial, but you don't wanna be too superficial either. So the idea is, if you think about where that hair follicle is, it's right in the dermis. So you wanna go through the epidermis, and you'll start getting comfortable. Sometimes you're gonna go too deep, sometimes you're gonna go less. My trick with PRP, with the hair, is I usually put them in and then I inject as I withdraw, because that way you're gonna get that follicle, and you want to bathe it essentially. The other thing too is I try to get some on the surface of the scalp and I rub that in. I even take a little bit at the end just so it stays on topically, and then that's where if they're not washing their hair for 24 hours, it continues to penetrate in, which is great.
Yes.
We have 2 options for administering it. So I told him I kind of let the patients decide, but basically you can do it where it's 1 needle, 1 syringe, and you do a grid-like pattern. It does not have to be perfect, because it's not like Botox where it has to be very precise. It's gonna spread and go everywhere, so you kind of get generally in that area. The other thing we have are these needles. They're 3, so they fit on, and they're literally like 3 prongs.
Oh.
Those are nice because they give you the exact depth, because you can't go too deep, they're tiny. But it also gets it done faster for them because it's very uncomfortable, and people struggle with it. And I've done locals, and locals are a pain because you end up having to numb them all the way here, and it's just it's not worth it. So and I do like basically 0.1, and it's not exact. You'll see I just kind of do droplets. That's what I think about. Think about droplets and bathing the follicle. I recommend doing always a minimum of 3 treatments a month apart. A lot of times people need up to 6. So what we do for our pricing is we do like a package of 3, and then after that, if they want to purchase 1 at a time, they're discounted. If somebody just wants to pay for 1, it's a little bit more expensive because you want them to do the 3 or they're not going to see the effects. Yes. And I also tell them it takes 6 months to see. All of PRP is slow, and I tell patients, what I always say to them is, our bodies are slow. You are not going to see, I tell them more than it's going to be, because if they are expecting to see something in a month, they're going to be upset. So I'm like,
oh my goodness,
yeah, so then you just say, don't expect to see anything for 6 months. Collagen production takes 30 days to start. So you're not even getting collagen production for a month. So that way they have that expectation as well. I find expectations is the biggest thing. As long as you gauge them out, like what is it, under promise, over deliver. So yeah, so then for facial rejuvenation, we're thinking texture, we're thinking improving wrinkles, improving like the firmness, the thickness. It really like especially under eyes. Like if somebody comes to see me and they have dark or crepey texture, it's really nice for that because it's going to thicken that dermis and make it so it hides it better. It's not going to volumize, but it's just going to help improve that. Some people talk about filler for volumizing. It's very minimal. It doesn't work like a filler. Like you'll never get that kind of an impact, but it definitely can help tighten everything up and make it look more youthful. Acne scars, it's great for as well. Acne scars, I would do the combination with a microneedling. So you microneedle, after you microneedle, you put the PRP on topically. You don't put it on. Some people talk about it, but most of the studies show you do it after because you can kind of denature it when you're, pounding it through. It's better to just put it on topically once you have those channels open so it can soak it in. Acne scars are deeper, they go into the dermis, so you have a deeper, so what I would suggest is almost a combination. If someone's got really deep like pock marks, I would do the microneedling with PRP, and I would also inject the PRP into that scar, so you get sort of a concentrated spot for it. The PRFM, I really limit to under eyes is really what I do. I've tried it in other areas, but people find it very painful, and I find it's too thick. Like scalp, you want it to spread. Rejuvenation, you want it to spread. Microneedling, you want it to spread. Here, you don't want it to spread. You want it to stay right there. The lips, the lips are gonna get a little bit of improvement because you're gonna improve the texture, but it's not gonna, I would say it's probably not gonna be significant enough where someone's like, oh, I'm so, they look amazing. I would do filler for lips or lip flip with Botox.
Okay.
Those are the best because they give them quick results, and Botox is just little droplets right there, and that's it. You follow Injector Bunny?
No.
Okay, follow her because she's a teacher, and I've done a ton of trainings with her too. She's in DC, but all of her videos are trainings, and she's always got great tips, great advice. She does whole, there's, Patreon where you can pay to have a membership. She's on there, and she does full teaching videos. The other thing I see a ton of, and you probably will too, is melasma. And melasma is tough because melasma is basically hormonally related. It can be made worse by lasers, by IPL, because of the heat component, because melasma can get triggered by heat. So the best, hands down, is microneedling with PRP. That's what we do. The results are amazing. We have one of our nurses, she's got the worst melasma. Her results are incredible. It completely eliminates it. But in those areas where you have the melasma, spend more time, go a little deeper, and definitely do it with the PRP because you'll get that added sort of boost with it. And it's, what it is with melasma or with any pigmentation is that pigmentation is kind of coming up into the layers of the skin. So again, you're wanting to stay in that skin level because you want your cells to slough off so the pigment goes away. The thing I always tell them, that's the healing. That's actually what you want. It's we're causing trauma intentionally, and sometimes it takes a long time. Like when I do RF microneedling on my neck, it's like 2 months where I see dots. But it's doing what it's supposed to do. So it's like always reminding them you're doing this to cause trauma. So your body heals and makes it healthier. And I can tell people till I'm blue in the face and they still will call the next day panicking. So it's like, we had a patient yesterday who did microneedling and called us an hour later and said, she's more wrinkly. I'm like, you just had it. We didn't make wrinkles, I promise. So you're gonna get it all. Like that's just part of it. But so for her, someone like that though, I would definitely tell them that's good. We want that. It means you're healing still. And just keep it hydrated. Hyaluronic acid is a great one for that. Then this is the periorbital, which I told you about, and it has sort of the calcium gluconate, and then this is sort of the injection techniques, but I'll show you once we're in there. But when you do tear trough, you want to stay on the orbital rim. I do a couple layers. I do a deep layer on the orbital rim, and then I come out, and then I go very superficial right underneath. So you kind of get that whole layer of skin to get improved texture. Most people it's here. Most people don't have too much here, so that's sort of my focus. And I always tell them they're gonna look worse when they leave because it's a lot of volume, so they'll be really puffy here. And then over the next week, they're gonna stay a little bit puffy. So I always say for planning, you're gonna have downtime, that's what I say. So the fluid will come and go. So you'll see like pockets appear, and then the patient will say they come and go. Usually if it's fat, it's gonna be more right underneath the eye, and the fat will be bulging out. The fluid tends to be lower, like right here. And tear trough filler is really hard to do, and it drifts down and causes swelling. So it's a very, I prefer PRFM for people. I have patients I still do filler on, but that to me makes such a difference because you don't risk any of that puffiness from happening. But that, a lot of that's the placement, and you have to be really careful if somebody's got that swelling and you're wanting to do your tear trough filler. You're gonna have to be really careful and go very high because you don't want it to drift down. Okay, this is where I was saying, adding the microneedling. What microneedling device do you have?
I have the Dermapen.
Oh, perfect. Okay. So yeah, I love it, and we just do it after, for things. Patient selection, you're gonna look for anyone that's complaining about like feeling dull, aging, thinning hair. Those are like prime candidates for PRP. Melasma, sun damage, scarring. Those are all gonna be addressed by these. The patient selection. So, these are basically the big contraindications, but I'll tell you, like, off of this, what I learned from my mom, they say, metastatic disease, but they make it like active metastatic disease. My mom always said to me, and she's like, it's not been tested that long, like, we don't know.